Mweneni wa kihonia kia murimu wa COVID-19 ni wambiriirie kuonekana thutha wa bururi wa Russia kuuga ati nimonete ndawa ya murimu wa COVID-19, undu uria urehete gikeno kuri muingi aria monanitie gikeno kiao kugerera nenda cia ukinyaniria.
The update on COVID-19 in the country in terms of our response measures as at the 11th of August 2020.
Kuringana na mutafariri wa mihango ministry-ini ya ugima wa mwiri ndagitari Mwangangi uria utugiritie wirutiri wa bururi wa Russia, oigite ministry ya ugima wa mwiri ni kwaraniria na ministry ya maundu ma nanja niguo kumenya kana ndawa iyo ni iraruta wira, kuria oigite ni mekurumirira mitaratara iria kendekana riria ndawa iyo igetikirio mabururi-ini mangi.
Always, every time you have a new vaccine, to test it. And I'm sure Russia itself is probably going to be conducting, studies even as they deploy their vaccine to ensure that it is actually effective. Back here at home, we are very proud of our scientists. Yes, Kenya is participating. We're in the second phase and we have teams that are working, and we'll continue to appraise you in terms of our progress back here at home. And also, if it should be necessary for us to then plug into the Russian vaccine, that will happen in the laid down protocols and regulations of us being able to access that vaccine.
Maya magithiaga na mbere murimu wa COVID-19 riu ni wigireire na miri guothe bururi-ini. Kaunti ya Samburu ikiingira ithabu-ini ria kaunti iria igumirwo ni murimu uyu, kuria yandikithitie arwaru 10 rungu rwa mathaa 24.
Samburu, which was the last county that was unscathed, now has cases, and today has 10 cases of coronavirus. And from these figures, it becomes increasingly clear that the virus now is within us, it is within all the 47 counties, and most importantly that Nairobi, with the 16,000 plus cases, has now been identified as the epicenter of this pandemic.
Umuthi andu 497 ni omonekanite na murimu uyu thutha wa andu 171 guthimwo rungu rwa mathaa 24, kuria andu 467 ni a Kenya na 30 ni a kuma nja wa bururi.
This now brings our total count of cases in the country to 27,425. It pushes our cumulative tests to a little over 350,000 to 362,501 cumulative tests so far. From the tests conducted, 467 are Kenyans, whereas 30 are foreigners. 312 are male, 185 are female. And the youngest is a 6-month-old infant, and the oldest is 80.
Namba ya aria makuite bururi-ini ona kuri oguo ni ongererekete na andu 15 na gukinyiria namba ya ikuo cia COVID-19 bururi-ini 438.
And out of the 15, 11 of these cases have underlying conditions. These conditions continue to be those that we've spoken about in the past. I think we have a large proportion of them today being diabetic hypertensives. And then we also have others who have other conditions such as kidney failure.
Ministry ya ugima wa mwiri ni koretwe githurima itandaire iri kaunti-ini ya Nairobi na gukinyaniria na riu thibitari 19 nicio cithuthuritio, kuria kuri na itanda 1,180, kuria 1,104 ni cia kuiga arwaru a COVID-19 keheri-ini, nacio 76 ni cia ICU. Mwangangi akiuga mutaratara uyu ndurikiriire.
Nairobi has to put more effort in being able to meet the 300-bed minimum requirement, and there are interventions to ensure that this is underway. We remain pleased with the efforts that have been put in place by the NMS team, who are looking to improve facility coverage and projections so that they can close the gap of these beds.
Handu-ini ha Kameme TV getwo Waithira wa Kihara.